Good morning, students. Today's dissection. So it's about the dissection of face. Okay. So we are going to dissect the face. So before that, what is the skin over this face? Okay. So the skin face has got skin followed with superficial fascia. Deep fascia is absent over the face. It's very important. And then comes the facial muscles, because the muscles of facial expression. So first of all, what is face? Hope you know the face. Okay, so that lies the, uh, the facial skeleton of the skull. So otherwise skull, of course, is cranium, cranium. So that extends from the vertical extent. So that is from the hairline, normal hairline to the chin. Okay, so the normal hairline to the chin. So that is the vertical extent of the face. The horizontal extent. So that is in front of the ears. Okay. So that's about the vertical and the horizontal extent of the face. Okay. So where we have the very important the external part of the nose. That is the important prominence of the nose. Okay. Face is the external part of the nose. Then comes the lips. Of course, then comes the chin. So we have the cheeks here. So cheeks. These are the main important the regions, sub-regions of the face that we come across. So if you see the nose here, so it has got of course one of the parts of the nose. So this is called the root of the nose. Okay, root of the nose, and this is the bridge of the nose. What is this? The bridge of the nose, and this is root of the nose, or the angle of the nose, so followed by the dorsum of the nose. What is this area called? The dorsum of the nose, and we have the lateral surface of the nose. So this one is lateral surface. This side, and we both the right and left lateral surface of the nose. Okay, so if you see the lower part of the lateral surface of the nose, there comes a rounded elevation. What is this called? Ala. Okay, so ala of the nose. So these are called ala of the nose. Okay, ala is singular, ala is ala of the nose, and of course this part in between the two alas we have a tip of the nose. So this is tip of the nose. Okay, so these are the main parts of the nose, and of course, apart from that, so we have the palpebral fissures. So you can see here. So the two eyelids, in between the two eyelids there is a slit-like opening. What is called palpebral fissures, presenting the medial angle and the lateral angle. Medial angle, lateral angle, and here the mouth. Okay, we can see the oral fissure in between the two lips. So this part is of course chin. So we have the cheeks, that is formed by the malar prominences. So these are the main features, the extent of the face, and the main the sub-regions of the face. So we have the main important the prominence of the face is the external nose, and here comes the nostrils. Okay, the external nares, otherwise called external nares, of the external nostrils of the nose. It's about the introduction part of the face. We'll come to the skin part of the face. So the skin over the face. So it is separated by the trigeminal nerve. Okay, the three divisions of the trigeminal nerve, so that carries the general sensation from this face. Okay, the touch, pain, temperature. Because it is carried with the three divisions. So now that we started the head and neck part, so we should aware about the cranial nerves. All the cranial nerves. It should be on your fingertips. Okay, it's very important. So we are dealing as face is concerned. We are going to deal with the trigeminal, of course, which is cutaneous, and the facial nerve. Okay, facial nerve. The touch pain temperature from the face. Of course, we have the upper part of the face and the maxillary part, the mandibular part. So it is carried by the three divisions of the trigeminal. So that's why it is called trigemina. Okay, so it has got ophthalmic division, okay, maxillary division, mandibular division. Okay, so these three divisions that carries the sensory innervation. So that is sensory innervation. It's a very important area. So the skin over the angle of the mandible. So this area, skin over the angle of the mandible, except this area, remaining entire the skin over the face, it is carried by the three divisions of the facial nerve. So except this area, it's very important. Those MCQ also. This area, it is carried by the greater auricular nerve. Okay, suppose it is transferred to the cervical plexus. Remember, so this area is carried by the greater auricular, and the entire skin. Okay, so that is carried by the from the vertex. That is very important, from the vertex. So as we studied already in the scalp dissection, so where So okay, in front of the ears, behind the ears. Of course, in front of the ears we have all the branches of the trigeminal, and behind the ears they are for the cervical texts. Okay, so till the vertex. So all these areas. So this area is with the ophthalmic, and this area is with the maxillary. Of course, this is with the mandible. So that's about the sensory innervation of the face. And coming to the motor innervation, the motor nerves supplying the face. So what are the motor nerves? The motor nerves supplying the face. Only one nerve. So it's a seventh cranial nerve. Okay, what is called facial. No, the facial nerve, of course, that comes out of the stylomastoid foramina. So that lies within the substance of the parotid gland, divides into 5 branches. So we have a temporal branch, so the zygomatic, upper buccal, lower buccal, and here comes the marginal mandibular and inferior cervical. So these 5 branches you can see, so that supplies the muscles of face. So all the contractions and the expressions of the muscle, that is mainly because of the impact of facial nerve, the 7th cranial nerve. So the 5th cranial nerve, which is sensory, of course the 7th cranial nerve, which is contributing for the motor. Okay, so that's about the skin and the muscles of the facial expression. So coming to the dissection part, the incision for the dissection of face. What is the incision? Of course, we have the midline incision. So that starts from the forehead. Of course, the scalp. Okay, already we have dissected the scalp. So where the incision is, it goes to the midline of the scalp. Okay, so that way it is divided into 4 quadrants. 4 quadrants of the scalp, so by means of the midline incision and the coronal incision. So that starts from the ears. Okay, so right ear to the left ear. So there is a coronal incision and the vertical incision. So that way it divides the scalp into 4 quadrants. So we are going to continue. So with the midline incision. So the same midline incision which is given for the scalp. Okay, so that that is from the vertex. That is from the vertex. So we are going to give the incision. So that is a midline incision. Midline incision. So that goes for the root of the nose, the dorsum of the nose. Okay, you can see here the dorsum of the nose, and also the philtrum. So this area is called philtrum. The philtrum of the upper lip and the chin. Okay, so that's about the midline incision. Okay, and one more, there is a horizontal incision. So before that, so we have to retain the skin around the two important the areas. So that is what is this called? Okay, palpebral fissure. The palpebral fissure. Okay. So here comes the palpebral fissure. I am retaining the skin over the eyelids, and here comes the horizontal incision, that is from this area, the medial lateral angle of the palpebral fissure to the ear. Okay, so this is one incision. Okay, and I have retained the skin here, and also I am going to retain the skin over the oral fissure. Okay, oral fissure and around the mouth. So this has to go with the midline. So it will go with the midline, and from here this comes, and the way retaining the skin over these areas. Okay, the oral fissure, of course the palpebral fissure, and here comes the horizontal incision towards the ear. Okay, so that's about the incision part of the face. So I am going to remove the skin now. So thereby I am going to demonstrate the muscles of facial expression. So we are going to discuss both the superficial as well as the deep dissection of the face today. Okay, so where by giving the incision, so we have given the incision here. So that's about the facial face dissection and the incision part of the face. So I will dissect now, and will remove the skin. So thereby we will see the muscles underneath the skin. Hope you know the all the muscles, they are attached to the skin. Okay, so they are attached to the skin. So thereby it brings out the impressions of different moods. So that's about so here comes. So we have reflected the skin. You can see the superficial fascia. So within the muscles, where the muscles are situated. So all the muscles of facial expression, hope it is they are mainly grouped so into the muscles that lies around the palpebral fissure, the orifices mainly. So in relation to the orifices of the face, so all the muscles, okay. So the muscles that lies in relation to the palpebral fissure, so in relation to the external nares, so in relation to the okay, the oral fissure, Hope you know the muscles in relation to the palpebral fissures, the important muscle. So that comes here is so here comes the orbicularis oculi, so which has got of course the palpebral part. Okay, so the palpebral part that lies within the eyelid, so just anterior to the dorsal plate of the eyelid. So there comes the orbicularis oculi palpebral part. Okay, and of course there is an ocular part also, so that surrounds the orbit. So that's about the orbicularis oculi. Okay, and then comes here the corrugator superciliae, so that lies above the supraorbital margins, close to the supraorbital margins. Here comes the what is that? Corrugator superciliae, and here comes the procerus. So there is a muscle called procerus, so that comes here. So there is a procerus that lies here, and one more thing, so you can see here very nicely these two muscles. So these are the zygomaticus minor and zygomaticus major. So these muscles, zygomaticus major muscle and zygomaticus minor, these two muscles. And next comes so then here comes the levator, okay, labiae oris, levator labiae oris, and of course here comes the depressor labiae, okay, angulars, depressor labiae, and that comes here. And this area, so here comes there is a the transverse fibers. So what is this muscle called? The rhizoids. What is this? Rhizoids. So depressor anguli oris, levator anguli oris, levator anguli oris, that comes here. The depressor anguli oris, that comes here. Okay, and mentalis. So here comes the muscle called mentalis, and also the incisivus labiae inferioris, mentalis, depressor anguli oris. So all these muscles that comes here. So here we have the levator anguli oris, so that comes here, levator anguli oris, and the incisivus labiae superioris, that comes here, and also the levator, okay, labiae alectu nasi, okay, levator labiae alectu nasi, that comes here, and the transverse muscle. So and the work that okay, covers the dorsum of the nose, what is called the nasalis. What is that? Nasalis. So all these muscles, of course, that acts like the sphincters, of course, that constricts and dilates the oral orifice and the palpebral orifice, of course the external edge. So that is the main function. Ultimately, the muscles that constricts and dilates the orifices of the face. So that's about the superficial dissection. So where we have discussed the muscles of the face soon after the reflection of the skin. So you can see here with the incisions we have reflected the skin, and the muscles superficial fascia has been exposed, and within the superficial fascia, so there is muscles which are directly connected to the skin. That is very important. Okay, of course, so from the underlying bones to the skin. So that is the reason. So that brings out the mood changes. It is expressed on the face. That is because of the muscles are directly attached to the skin. So thereby these are called the muscles of facial expression. Muscles of facial expression. Okay. So that's about the superficial dissection. The superficial the dissection of the face, where we have seen the different muscles. Okay. You can see here nicely zygomaticus minor, zygomaticus major. So this area we have levator labiae. Okay, levator labiae. Okay, and depressor labiae. So very important. So there is the intramuscular condensation, muscular condensation. So 2 centimeters lateral to the angle of the of course the mouth. What is that called? Modiolus. What is that? Modiolus. So there is a modiolus here. So the modiolus that receives the depressor anguli oris, and here comes the rhizoius, and levator anguli oris. So all these muscles, the interlacing fibers of those muscles, that condensation, the muscular condensation, is what is called modiolus. So you can feel the modiolus by inserting the index finger inside the mucosa, and of course the thumb over the face. You can feel there is a condensation, muscular condensation, what is called modiolus. So the modiolus, of course, it supports the time of chewing, the food. So that supports the muscles of facial expression, and also very important muscle that comes here. So we have the buccinator. You can see here the buccal pad of fat here. So underneath this buccal pad of fat, so there comes the buccinator. What is that? The buccinator, and around the oral fissure. So here comes this is orbicularis oris. Orbicularis oris. So orbicularis oculi, and here comes the orbicularis oris. So this one, orbicularis oris, around the oral fissure. So apart from that, we have the other muscles also, and here comes the orbicularis oculi. So these are all the muscles that lies within the superficial fascia, which are responsible for the muscles of the facial expression. All these muscles, they are supplied by the facial nerve. They are supplied by the facial nerve. So of course down to the this area, so you can see the platysma also. Here comes the platysma. Okay? So that is also that lies. It is like the muscles of facial expression. So all that lies in the subcutaneous. All these are subcutaneous muscles that lies within the superficial fascia. It doesn't. It is attached to the skin directly. Of course, it is otherwise called panniculus carnosus. What is called panniculus carnosus? Okay, so that's the terminology. Just remember the muscles of facial expression. So otherwise called panniculus carnosus. Like we have the panniculus adiposus in the lower limb. What is called the specialized muscle type of fibers that stores the fat in the lower limb. What is that muscle? So gluteus maximus. So what is here called panniculus carnosus. So these muscles are called panniculus carnosus. So thereby this muscle that moves the skin over the face. Okay, the skin over the face is movable, and also because of the contraction of these muscles, the moods are expressed over the face. So that is the reason these are called panniculus carnosus. So that's about the superficial dissection. We'll go to the deep dissection of the face, where we can see the facial nerve and the facial vessels that supplies the face. So after the superficial dissection, so where we have seen the muscles of facial expression, okay, and come to the deep dissection of the face here. So you can see the nerves and vessels of the face. As I told, the facial nerve, of course, very important nerve that supplies the muscles of facial expression, okay, and the facial vessels. So we have the facial artery, the facial vein. So you know the facial nerve. So it is the 7th cranial nerve, okay, so that it comes out of the cranium through the stylomastoid foramen. So there is a foramen called stylomastoid foramen in the norma basalis. So between the styloid process and the mastoid process, so through which the facial nerve it descends. Okay, it comes out of the cranium, and so it enters the parotid gland. You can see here there is a parotid gland. So there is a parotid gland, and as I told, so the superficial fascia, deep fascia is absent over the face except the parotid region. So here you can see the deep fascia, okay, but the deep fascia is absent over the this part of the face, but it is present here, the parotid region. So that encloses the parotid gland. You can see here there is a parotid gland here. So the parotid gland is the anterior border of the parotid gland. So here comes the anterior border of the parotid gland. So in relation to the anterior border, the facial nerve, so it divides into two divisions, upper division, lower division. The upper division, of course, that gives temporal, the maxilla, the zygomatic branch, and of course the buccal, upper buccal, lower buccal. So these are the branches from the upper divisions, and the lower division that gives the marginal mandibular and inferior cervical. Okay, you can see the inferior, the cervical here. So there is the inferior cervical, and so these branches. So within the substance of the parotid gland, it's very important, the structures based on the parotid gland that we'll discuss in the parotid region. Okay, so the facial nerve, the two divisions that gives five branches that supplies the muscles of facial expression. Okay, so next, so we have the facial artery. You can see the facial artery here. So the facial artery, which is branched from the external carotid artery. It has got, of course, cervical part, facial part. Cervical part, facial part. The cervical part that gives the ascending palatine, submental, and of course the tonsillar branches. After giving those branches, the facial artery, it winds the body of the mandible. So in front of the antero-inferior angle. So you can see the muscle here. This muscle is called masseter. What is this muscle? So this is called masseter. So this is a masseter muscle. Okay. So this masseter muscle, it has got antero-inferior angle. Okay. So in front of the anteroinferior angle, the facial artery. So if you want, you can palpate your own facial artery. So by clenching the masseter, by clenching the teeth, okay, you can contract the masseter. So thereby you can palpate the facial artery just in front of the anteroinferior angle of the masseter. So this is the area. So in front of the anteroinferior angle, the facial artery, the cervical part, it winds, thereby it becomes the facial part. You can see the facial part of the the facial artery, its facial part and the cervical part. Okay, so the facial part that gives mainly the inferior, okay, labial, superior labial, okay, and we have the nasal. So after giving these branches, the facial artery, you can see here, which it continues as angular artery. So that is the course of the facial part of the facial artery in the face, so which is tortuous. That is very important. It has got spiral course. Okay, it has got spiral course. Okay, so just that lies just in front of the anteroinferior angle of the masseter, accompanying the facial vein. Facial vein also seen, but the facial artery, it has got the tortuous in its course. So the tortuous course of the facial artery, so that allows the movements of mandible, and thereby it prevents the tear of the facial artery at the time of the elevation depression of the mandible. Okay, so that is why the facial artery that shows the spiral course or tortuous course in the face. So that gives mainly inferior labial, superior labial, nasal. Of course, after giving these branches, it continues as angular artery. So accompanies the facial vein. You can see the facial vein also. So here comes the facial vein. Okay, so this is the facial vein. So the angular vein, facial. When very important, the vein that receives important tributary here, the deep facial vein. So which is responsible for the spread of infections from this area, what is called the dangerous area of the face. So that includes the ala of the nose, the tip of the nose, and the upper lip. Okay, so the upper lip, so this area, or what is called dangerous area. So any infections in this area, so it is carried through the deep facial vein to the pterygoid plexus. So from the pterygoid plexus, sphenoidal emissary veins to the cavernous sinus. So that is the route for the spread of infections from this area of the face to the brain. That is this area is called the dangerous area of the face. So that is in relation to the facial vein. You can see the facial vein here. This is the facial vein. Okay, so the facial vein that joins with thereby forming the common facial. The facial vein joins with the common facial vein. So thereby it contributes for the formation of external jugular vein. So that's about the facial vein. And the facial artery, very important. You can see here very nicely the tortuous course of the facial artery. Okay, and coming to the branches mainly. So we have the branches of the facial nerve. So this is a branch. You can see this is the branch, the first branch, the temporal branch. Hope is it clear for you? The temporal branch of so in relation to the anterior border of the parotid gland. In relation to the anterior border of the parotid gland, so we have branches here. So there is the first branch, temporal branch, and then comes to the zygomatic branch. You can see the zygomatic branch. So this is the zygomatic branch. Okay, so this is the zygomatic, and here comes the temporal zygomatic. So we have upper buccal. Okay, and here comes the lower buccal. So lower buccal. Okay, so this is upper buccal, this is lower buccal in relation to the parotid duct. You can see the parotid duct here. So this is parotid gland, this is parotid duct. The parotid duct piercing the buccinate, of course, opens into the vestibule of the mouth, opposite to the second molar tooth, upper second molar tooth. So that is the opening of the parotid duct. You can see the parotid duct. So in relation to the parotid duct, so we have the upper buccal. So here comes the upper buccal. Here this is the lower buccal. And there is an artery here also. This is called transverse facial artery. You can see the transverse facial artery. So this is the transverse facial artery and the buccal branch of the facial nerve. Upper buccal, lower buccal, the zygomatic, and here comes the temporal. See the temporal branch. So this is the temporal branch, zygomatic branch. We have buccal. So in the buccal we have upper buccal, lower buccal. So this is upper buccal, this is lower buccal, this is transverse facial artery, and here comes the parotid duct. So next, the last two branches. Here comes. So you can nicely see this is the marginal mandibular. What is this branch called? See, marginal mandibular. So this branch is marginal mandibular. Okay, so you can see nicely the marginal mandibular. Okay, so the next the last branch from the facial nerve. So that is the inferior cervical. So here comes the inferior cervical branch. Of course, it has been cut here while doing the dissection, but okay. Still you can see the nicely. So here comes
the inferior cervical. What is this branch? Inferior cervical. So these are the 5 branches. Okay, you can see nicely the inferior cervical, marginal mandibular, the lower buccal, upper buccal. Okay, so and we have the zygomatic branch, and here comes the temporal. See the temporal branch. The temporal branch was supplying this area, the forehead, the muscles, mainly the frontal belly here, the frontal belly of occipitofrontalis. So this is a nerve. So these are the 5 branches of the facial nerve in relation to the anterior border of the parotid gland, okay, supplying the muscles of facial expression. So, muscles of facial expression, and the facial artery, so which has got a tortuous course. You can see the facial artery, the tortuous course of the facial artery giving branches. The facial part, hope you know the facial artery is branched from the external carotid artery. It has got a cervical part and the facial part, cervical part and facial part. Okay, the facial part branches. Hope you know the cervical part. It gives ascending palatine, submental, and of course the tonsillar branches. Okay, and after it giving the branches, the cervical part, it winds the body of the mandible in front of the anterior inferior angle, the masseter. Of course, thereby it starts its tortuous course and gives the branches in the face. We have inferior label, superior label, nasal, and it contains angular. Okay, angular, and here the facial artery accompanied with the facial vein. So this is facial vein. So here comes the facial vein, and this is facial artery. Okay, facial artery is nicely seen. So this is the facial artery, and here comes the facial artery. This is the masseter muscle. What is this? Masseter muscle. Okay, and we have all the muscles of facial expression here. Okay, so you can see this is the zygomaticus major, zygomaticus major. This is minor, and here comes the levator anguli ovaris, depressor anguli ovaris, the mentalis. Okay, so that's about the superficial, the deep, and of course the deep dissection as well. So that's about the dissection of face. Dissection of face. Go through the diagrams and try to understand the facial nerve. It's branches mainly. So it's like a goose feet appearance. Okay, goose feet appearance. So like this, the facial nerve, it gives branches. We have a temporal, zygomatic, upper buccal, lower buccal, marginal mandibular, and inferior cervical. Inferior cervical. Okay. Hope it is clear for you, the dissection of face. Okay. So with that, I will stop the dissection face, and of course in the next coming class, the dissection will further will continue with the further dissection. Thank you for your patience listening.